Good afternoon and welcome to the Multicultural Media Online Conference, here hosted by New South Wales Health, Multicultural Health Communication Service and Multicultural New South Wales. I'm Jesusa Helaratne, Deputy Director of the New South Wales Multicultural Health Communication Service, and we're so happy that you've joined us again today. I would like to begin by acknowledging the traditional owners of the land from which we are all meeting today. We acknowledge the traditional custodians of the land, the Camaragal people of the Ku-ring-gai tribe of the Eora Nation, from where Dr. Jan and I are coming from. We pay our respects to elders past and present, and emerging and extend the respect to Aboriginal elders and colleagues. We also acknowledge the elders from all multicultural groups represented on this online briefing. And today we are glad that Minister for Multiculturalism, Natalie Ward, is back to give you some updates on COVID, and of course, Dr. Jan Fizzell, Senior Medical Advisor of New South Wales Health. We would like to request if you can please keep your microphones on mute, but make sure that you add your questions on the chat. So let's start. Minister Ward, how are you today?
Hi, Jess. I'm great. Great to be with you. I am having some technical difficulty though, so please forgive me for not I've got sound at least, so we can communicate still. Thank you to my phone. So my devices seem to have given it up and they're ready for the Christmas break, I think. So wonderful. So we might get started, if I may, if you'll forgive me for just sound only. But hi, everybody. It's just great to be with you all again. I, of course, acknowledge the traditional custodians of the lands on which we meet and pay my respects to the Gadigal people, and I thank them. As we head towards this holiday season and summer, I just wanted to thank everybody once again for the fantastic work Multicultural Media has done to help us all navigate our way through this 2021 year. I can't wait for summer. I can't wait. It's here for everybody to be able to get out and see each other again. We have such a wonderful mix of harmonious multicultural communities here in New South Wales, and I just want to thank everybody for their great work this year and your contribution in delivering those vital public health messages, for your information and guidance. It's just been so vitally important and will continue to be as we go forward. Of course, you are our trusted sources. Your communities have looked to you, to your leadership, to your messages and information. You are their multicultural media, and along with our community and religious leaders, I just want to personally thank you for the wonderful work you've done in our journey together this year. Of course, the challenges do continue. We are confronting the Omicron strain of COVID. We know that we've seen some numbers go up today. I'm sure Dr. Jan will be speaking more about that, but I just wanted to echo the Premier and Minister Hazzard's messages today. It's just as important as ever to ensure that we're abiding by those public health messages, which we know so well, and just to underline those. If you are eligible for a booster shot, go and get one as soon as possible. I got a text message from Health saying you can go and get your booster. I've booked in. I encourage everybody to go ahead and do that. Isn't it wonderful that we're at this point where we've all had, majority have had double vax, and we know what to do and where to go. So if you're eligible for that, please do go and get it. You're now able to get that booster after 5 months of getting your second vaccination. So you don't have to wait for the 6 months. You can go ahead if you are at the 5 months. And thankfully, Health will give you that reminder if you like me and not quite sure of the timing. That has been brought forward, of course, from the 6 months. So it's really critical that people get the booster. Just think of it as your third vaccination. It's just as important as the first and second. Think of it as your third. That ensures that we can all get out there and enjoy the summer together, and all the hard work that we have done so far we'll just continue to build upon. If you contract COVID, the booster will stop you getting very ill, and we know that that is absolutely crucial. So I urge people to rethink just their plans. Make sure that you're careful if you're going into a crowded environment. Just use your caution and your common sense, because we've worked so hard on that so far. If you need to distance or wear a mask, you're still most welcome to do so. We're all very used to sanitizer now, which is fantastic. And we know that we still have to wear those masks on public transport and in some venues, but otherwise it's reasonably open at this time. I just want to also thank quickly Multicultural New South Wales and everybody there, and Multicultural Health and you, Jess, and all of the team that's worked so very hard together with New South Wales Health and Multicultural Health Communication Services to engage with our multicultural groups directly. It's been such a privilege for me during this time. And maintaining that direct engagement with our religious and community leaders to share that information as we've gone along our journey has been really important. This will continue to ensure that all the up-to-date health information is delivered in language, and we will be holding a new round of forums with community leaders and religious leaders in our non-government organisations, just to ensure that we're continuing that dialogue and hearing feedback from communities about what is needed. But since the outbreak this year, we have continued to make sure we're trying to reach out to every corner of our beautiful multicultural community. Since June, we have translated 2,456 public health resources into 61 languages. I just want to thank all of the team there, our wonderful translators and interpreters, for that incredible work translating those health resources. We've held 100 forums, Jess, do you believe it, this year? 100. To hear and understand our community's needs and concerns. And I want to thank all of you for participating in those, and everybody that's given me information and feedback and spent time interacting. They're incredibly important to help inform me as your minister and to inform the New South Wales government on our road ahead. We made it a priority to get money out the door to those who needed it as quickly as possible, and that included our wonderful multicultural media, and of course the record $54.7 million to support our vulnerable communities and our multicultural communities experiencing hardship during the Delta outbreak. That of course included $38 million in grant funding to our vulnerable communities, but we know there's more to do. Our work is ongoing. We'll continue to do that throughout the year into the new year, and to head off any of those challenges in 2022. The absolute best part of my job though, Jess, and I'll finish up on this, is the ability to meet communities and meet people face to face now and see our communities join together. And I particularly was so heartened to be able to see dozens of our Afghan evacuees take part in a game of community cricket at Bankstown last week. It was so exciting. And I want to thank Settlement Services Australia, Cricket New South Wales and Cricket Australia for organising that wonderful project, the Welcome Project, because since August, of course, New South Wales has opened its arms to over 1,100 evacuees from Afghanistan. So to see them enjoy a peaceful game of cricket outside as we all interacted was absolutely a highlight for me. I'm looking forward to speaking with you all more during 2022. And I just want to thank you very much, Jess, and all of the team for working so very hard up to this point. Thank you.
Thank you so much, Minister. And you have done such wonderful work. And we also want to thank you for all the updates and all the resources that you've been giving us, and the grants that's been provided by Multicultural New South Wales. And Minister, thank you for always being available to answer all the questions. So it has been wonderful working with you in 2021. And when you said 100 forums, I can understand that most of those forums were with Multicultural New South Wales, and Dr. Jan was also around for those forums. So it's been wonderful for the collaboration. So thank you very much, Minister. And I'll pass this on to Dr. Jan, our Senior Medical Advisor from New South Wales Health, for an update on COVID.
So thanks so much, Jess, and thank you, Minister. So we had 1,360 cases of COVID recorded in New South Wales overnight. That's one of the largest numbers we've seen in some time. We had 110 cases of Omicron that were whole genome sequenced to this date. And sadly, we are still seeing deaths. We saw the death of a woman in southwestern Sydney, and our condolences to her family. 94.8% of people have had that first dose of vaccine who are age 16 and over, with 93.2% of people fully vaccinated. And it's really important that if you've had that first dose of vaccine, to get that second dose of vaccine. And as Minister Waters said, if it's been 5 months since you had that second dose, to make sure that you do get that booster booked in and have it as soon as possible. It's also important that our young people aged 12 to 15 keep being vaccinated. School may be out, but it's a good time to make sure that their vaccination is completed. 81.4% have had a first dose of COVID vaccine, and 77.8% are fully vaccinated. Of course, like the community, we're very concerned here in New South Wales Health regarding the increase in cases, particularly in the Newcastle area. That's largely been driven by what we believe to be the Omicron variant, and we have seen this uptick in cases across the state. And while we've had some relaxation of restrictions in the public health order, just to remind people of the Chief Health Officer's message from today, that whilst you may not need to wear a mask under a public health order, if you're thinking about going indoors, do think about wearing a mask. If you are outside or you're about to have a social event, do think about whether you're having it indoors in an unventilated venue versus having a social event outdoors, where, you know, the weather has been nice for a change. It's been a bit of a wet start to the summer, but socializing outdoors. If you are about to have a large family gathering, do make sure that you don't go if you're feeling unwell. And also, of course, do make sure that if you've been asked to isolate, you remain in isolation. And if you want to encourage everyone to have a rapid antigen test before you have a large get together, it just may help protect your family, your friends, your community as you get together over this weekend.
Thank you so much, Dr. Jan. We'll go on to the questions now. Keith Tan from the Chinese media has asked, with restrictions lifted for the unvaccinated, there are rising concerns and a spike in cases to 1,360, as Dr. Jan has said. What will New South Wales Health be doing to confront this challenge? Dr. Jan.
Look, I think we know that we are going to see an ongoing increase in case numbers. The key things will be about us understanding our own personal risks, doing what we can to mitigate that personal risk. So that means getting vaccinated and making sure that our vaccinations are up to date. So if we're eligible for a booster, don't put it off. Don't say I'll get round to it. Do book it in today. There's lots of appointments available. So please do get vaccinated. Do make those careful choices about where you go and what you do. If you know that there's COVID circulating in your community, think very carefully about where you go and how you do it. Most of my shopping's been online this year, but if you are venturing out, think about, you know, am I going at a peak time of day? Am I going outside of those hours? And of course, we'll continue to be interviewing cases as far as we can and asking them and their household contacts. So they're people who live in the same house as you or that you've spent 4 or more hours indoors together with, to make sure that they get tested and isolate for 7 days. There will be some social contacts. You may get a message from a friend or a family member saying to you, hey, you know, we may not have hung out for 4 hours, but I've got COVID and you've been around me, please get tested. So please just to be really aware that if somebody does message you saying that they've got COVID or they've been exposed to COVID, just think really carefully. Do you need to go and visit that elderly, vulnerable person? Do you have a friend who's got cancer that you might have been dropping in on? Think about who you're visiting and how you're visiting them before we accidentally spread COVID to people who may do badly with it.
Thank you so much, Dr. Jan. Minister Ward, Marina Belkina from Russian Talk TV or Russian TV channel has asked the same question. New South Wales has the dramatic increase in the number of cases. And what is the reason for the jump? And what methods are the New South Wales government to help reduce this? Minister Ward.
Thank you very much. Yes, we have seen that jump, of course, and that was not unexpected. We know that the health advice continues to be delivered, and we're very clear about that. At the moment, we are expecting a bigger increase in numbers, and we're very clear that we need to learn to live with the virus. We can't shut down the economy every time we have an increase in numbers, but people are well aware of the health advice. We know now that it's part of everyday living. If you feel, you know, wearing a mask is safer, please continue to do so. Please continue to use the hand sanitizer and social distancing. Obviously, being outside is preferable for larger groups. And, you know, all of the usual health advice should apply. But we've also been very clear that we do wish to open up. We have taken that step today. We have indicated that it's only in certain circumstances that we will require a mandate that masks be worn. We're obviously opening up, but saying to people, continue to heed that health advice for your friends, for your families and for yourself, which is to make sure you're getting those vaccinations first, second, and what I will call as the third or the booster. Make sure you're getting those and that you're encouraging others to do the same. We do need to learn to live with this. We're not going to shut down every time we see these numbers increase. And of course, that will be based on the health advice and ensuring that our settings are correct, that we're reducing risk to people, but we're balancing that with keeping the economy going and keeping us moving forward, particularly in the summertime. So we're working together, of course, to get that balance right. And thank you for Health for working with us so closely on that. We'll obviously watch that space, but our intention is to open up for the summer and keep it that way. Thank you.
Thank you so much, Minister Ward. And I guess following on from what you said about masks, a question here is, you're saying we don't have to wear masks, but Carrie said we should. What is right? And how should the community feel comfortable about wearing masks in terms of the rules? Dr. Jan.
Look, I think the thing is, we know a lot of people find masks quite uncomfortable and they don't like wearing them. But at the same time, we do know that masks do offer protection from, if I'm unwell, I won't give it to you, or I'm less likely to give it to you if I'm wearing a mask, and I'm less likely to catch COVID from somebody else if I'm wearing a mask. And so it comes down to personal choice. And I think it's a little bit like, to some extent, wearing sunscreen. You know, it's a really good idea. We don't have, you know, if you're a kid and you're at school, you have to wear a hat or play in the shade. But then at some point we take responsibility and say, look, we're trying to give you shady spaces to go. Sunscreen's available, hats are available, please slip, slop, slap. It's the same sort of thing. Take some responsibility. Think about where you are. If you're in an indoor environment, no one's around, there's no need to have that mask on. But if you're going into an indoor environment with lots of people, or you're going into a higher risk setting where there are vulnerable people there, putting that mask on can just help protect people.
Thank you so much, Dr. Jan. Just wanted to ask here as well. I heard we've been, why did the booster dose get brought forward to 5 months? And I guess, Dr. Jan, that's another question for you.
And I think that's where we work with our immunisation experts, the Australian Technical Advisory Group on Immunisation. And basically what they're constantly doing is looking at the evidence from around the world as to the right gap for boosters for the level of disease in the community. And so when they first gave advice, the best evidence was at 6 months. Now they've got advice at 5 months, and we may see it get even shorter. I know the UK's come out at 3 months. So it may not be that there is one particular right or wrong answer. It's about what's the best evidence that we have for when we do the booster, what's the disease transmission like, and what are we trying to achieve by it. And so I rely on the people who spend all day, every day thinking about this to give me that guidance, and that's who I trust. And so if they say the evidence is now that 5 months is the time, 5 months is the time that I would be getting my booster. And if they change it to 4 months, it'll be 4 months.
Thank you, Dr. Jan. And I too, like Minister Ward, I received a text from New South Wales Health, and I've only had mine in 5 months, but I'm going to get my booster shot. So I think that's important. Minister Ward, here's a question from Pawan Lutra from Indian Link, Mixed Health, and a question for Minister Ward. Hearing from Minister Hazard that cases can rise to 25,000 by mid-January was very alarming. The multicultural community played a huge role in getting the vaccination rates to where we are now at the moment, but I'm not seeing the same urgency in encouraging boosters. What is being done to dial in the community to replicate the success of the past? And he also says, I believe urgent dialogues are required between Multicultural New South Wales, New Department of Health, and community groups and the Department of Customer Service. Minister Ward, what is your comment?
Thank you, Pawan, and thank you for your question. Great to hear from you again, and thank you for the wonderful work Indian Link has done. I think we're going to need a new Bollywood message for the booster, so if we can get the new video out, that would be amazing. But I love what Dr. Jan said about thinking of it like sunscreen. You know, we should be using it where we can, use masks where you can, all of those health measures that we're so used to right now, we should be encouraging. But also, again, multicultural media plays a critical role in supporting and conveying and getting those messages out to all communities in language to say, please go and get your booster. You will see, Pawan, you will see a lot more messaging from the government, from health, and hopefully from our multicultural media, of course, from our religious and community leaders to emphasise that we must be going out and not getting complacent, but getting that third vaccination, that booster, making sure that we are encouraging family and friends to do the same, and making it really easy to do so. You can do your booster at your local pharmacist, which is fantastic, and we know that it's been critical to communities to go locally where they know their trusted pharmacist or their GP. You can go there now and book in for that booster. But it's, again, really important that we deliver those messages in language, including the booster message. It's an absolute priority for me, and that's why I've asked Multicultural New South Wales to continue for us to have those forums with community leaders, with religious leadership, so that the community can understand. We've done so much hard work. We've really gotten to such a great place with our high vaccination rates. Let's keep that going, and people are very used to it now, so we know what to do, and continue the messaging and the interaction so that we can really work together. So you will see a lot more around that, and you will see me working closely with communities again through those forums. We hope to get a lot more of them to hear and understand community needs and concerns around the booster. So thank you for that, and we'll work together on seeing your next Bollywood message. Thank you.
Thank you so much, Minister Ward, and thank you, Pawan, for that question. Mariam Murad has a question, Dr. Jan. If you have had Pfizer vaccine, what's the health advice for the booster vaccine, Pfizer or AstraZeneca? I think that question, this has come about, and it's an important question.
Sure. So the booster vaccine recommended is one of the mRNA vaccines. So that's either the Pfizer or the Moderna vaccine. If for whatever reason you can't have those vaccines, say that you're allergic to one of the components in those vaccines, you can use the AstraZeneca for the booster, but the preferred is the Pfizer or the Moderna. So even if you had AstraZeneca for your first course, you can have Pfizer or Moderna. If you had Pfizer for your first course, you can have Pfizer or Moderna, Moderna or Pfizer for your booster. We don't have the evidence that mixing and matching makes a huge amount of difference. It may help, but the key thing is go somewhere where it's available and easy for you to get to. So don't put it off for 3 weeks because you're waiting for a particular vaccine. Go where it's, where you can get parking, where you've got an appointment at a time that suits you. Go for what works for you is the key.
Thank you so much, Dr. Jan. Serena Simam-Labong has asked a question. Check-ins are no longer required at most venues, but how are people going to find out if they may have been exposed to a COVID case that used to be available as an alert on the Service New South Wales app? I'll pass this on to Dr. Jan, and Minister Ward, do you have a comment?
Yes, thank you. We know that people are very used to the check-in, and if businesses would like to continue, or venues or entities, cafes would like to continue with that check-in, they can. But we're saying and they're also able to still request vaccination status proof. But Dr. Jan might like to speak to the specifics of those details. But we're certainly encouraging people to continue if they want to. And I think we're also very used to it now that we've got the app in place and the QR codes. People are well and truly used to that. So we'd encourage that if you want to. But Dr. Jan might speak to the specifics of the tracing and notification. Thank you.
So at the moment, we're still able to interview everybody and ask them where they've been and what sort of venues they've gone to and check where they've gone to across their QR code data. And then we're able to message people through Service New South Wales. With really high numbers of cases, we'll be able to actually ask fewer questions of people. And so it'll be really when people start drawing out to our attention that there may have been transmission at a particular venue that we'd be messaging people. And you may see that done just as we've done with some of the recent public transmission venues where we've put it out through the media as well as through the app, as well as direct messaging people. So certainly if we have a high index of suspicion that a place is a transmission venue, and that people who've been to a particular location need to be very aware that COVID was there with them, we'll certainly get that message out to people. But I guess the other key thing is to realise that COVID is in our community now. People are just doing normal, everyday things and they're getting exposed to COVID and they are catching COVID. So I think the key thing is to just keep those COVID safe behaviours going, make sure that you've got that mask on, make sure that you think about, am I going into a very crowded space and am I comfortable doing that? And if I have been in a very crowded space and I get any symptoms whatsoever, or just basically if I've been in the community and I get any symptoms whatsoever, have a very low threshold for going to a drive-through clinic or one of the other clinics to get a proper PCR test. Those supermarket tests are great for if you're trying to check if you might have something and no symptoms before you go to a big social function. But the test that really helps you if you've got those symptoms is that PCR test. So it's really important to get that PCR test if you've got symptoms, and particularly if you know you've been exposed to a location and you've been asked to get a test by New South Wales Health. Those drive-through clinics or those special clinic tests are what you need if you've been asked to get a test.
Thank you so much, Dr. Jan, for that advice. Minister Ward, the end of year holidays and gatherings are happening. A question here is, like what Dr. Jan said, to stay safe, but how can families stay safe when there's so many people with COVID around? And as you said, you've been traveling to lots of places, a lot of people are gathering. What can we do aside from just following the advice from New South Wales Health, but what is the government doing to make sure that this happens, especially with businesses as well?
Yeah, thank you. It's a great question. I think the number one thing to say is that we're very clear about the vaccination as the first line of defence. So getting vaccinated, continuing to ensure that if you haven't had your second shot or that you're getting your booster, that really is a priority. And you'll see a lot more information around that to ensure that even if you do you are exposed, that you still have that first line of defence for every individual, and that ensures that we're protecting families and communities getting together as we gather, in any kind of forum through our normal interactions day to day. We are all very aware that, if you're in a crowded place, you might, particularly if you're indoors, we still have some requirements, for example, on public transport, where you have to wear a mask on buses and trains. So we know in those confined spaces that it really is still a requirement to wear a mask on those. And we do ask that, if you're in a crowded space in a shopping centre indoors, we've said for hospitality staff, front of house staff who are not vaccinated, they must wear a mask. If you're inside at a concert venue, you really must be wearing a mask. And again, I don't think that you'll see hand sanitizer going very far. I think that will continue to be available, encourage that. But in terms of families, I can say that, if you are gathering, consider doing so outdoors. We've got a beautiful summer in New South Wales that we should be enjoying. Of course, as Sports Minister and Multicultural Minister, I would encourage you to get outside and move around, enjoy our beautiful outdoors and get some fresh air, kick a ball or enjoy some bocce or, something that you can get together as a family outside. We know that that's a best environment to be in, particularly for groups, and a wonderful way to enjoy picnics and barbecues and all of those great things that we can do in our fabulous outdoors. Also, just ensuring that you're maintaining social distance where possible, and that you're, if you feel any symptoms at all, that you still go and get tested. As Dr. Jan said, with the rapid testing, making sure that you're vigilant about that. If you know someone that is showing any of those symptoms that we have heard so often, that you really take that step. It's not hard to do. We know now where our clinics are. You can pop in and get a test really easily, and we encourage people to continue doing that. Don't write it off as just a headache or a tickly throat or a bit of a cough. Go and get tested so that you can be sure. And if you feel like you do have to get tested, then self-isolate at home. Just stay at home until you get that test result. I've had to do that recently, and it wasn't hard to do. Go and get the test, stay home, let others know, and as we emerge, I think that the great thing is that we're all to these protocols. It's not anything. It's wonderful that people. It's important that people do what they're comfortable doing, make common sense judgments about how you move around, who you interact with, and just take that common sense approach that we all know we've been for so long.
Thank you so much, Minister Ward. I guess we have, we're running out of time, but we have one more question. Are we seeing more Omicron or Delta cases, Dr. Janet? And does the vaccine not work with Omicron?
So we are seeing a lot more suspect Omicron cases. I think Dr. Chant talked about the fact that in Newcastle, we think nearly all of that outbreak is Omicron at the moment, but there is still Delta circulating in our community. And we've had some situations where we've had both Delta and Omicron in the same venue. So what can I say? COVID likes to party. Anyway, so having said that, what we do know, though, is that whilst the vaccine is possibly not as good at limiting transmission of Omicron, we're not seeing in South Africa, where there's been a lot of an uptick in cases, we're not seeing a big upswing in hospitalisation. We're looking very carefully at the UK, where Omicron's become the dominant strain there, and I would suggest that it's not unlikely that it will become the dominant strain here in New South Wales. The key thing for us is we still don't have all the information to tell us exactly how severe Omicron is if you're an unvaccinated individual. So you have to remember, in South Africa, a lot of people had already had an infection, and even if you've had Delta, and even if you've had Delta recently, you can become infected with Omicron. So we do know that natural infection with Delta is not enough to prevent you getting Omicron or being able to pass on Omicron. So the biggest information that we have at the moment is if you're vaccinated and you've been recently boosted or you've had your second dose, you are far less likely to get very sick. And that's come from both a test tube study that looks at people's blood versus virus, and also starting to come out of the real world data. So whilst the vaccination may not limit the transmission of Omicron as much as it does for Delta or the original COVID strain, it certainly has huge potential for preventing us getting really, really sick. So I think it's really important that we don't discount the importance of vaccination at the moment, and that if we've got people in our circle of friends, circle of family who are unvaccinated, we continue to try and protect them moving forward, because we just do not know what Omicron's like in the unvaccinated.
Thank you so much. On that note, it's 4:30, and thank you so much for joining us. But Minister Ward, I'd like to pass it on to you for any final remarks.
I'm so sorry for the technical issues I'm having today. I do apologise. It's been a real challenge. So sorry for dropping out, and thank you for your patience, everybody. Thank you so much, Jess and Dr. Jan. Thanks everybody again for your wonderful support and for getting the messages out there.
Minister Ward and Dr. Jan, any last words?
Just to say thank you everyone for the enormous work and effort you've put in this year. I think we'd all be far more nervous to be going into the next weeks with these case numbers if we didn't have the high vaccination rate that we do. And thank you for continuing to support our safety messages to the community, because we will still need them moving forward. But I really hope that we can start to enjoy the beautiful weather and being together as vaccinated people. It'll be fabulous.
Thank you so much, Dr. Jan, and thank you so much, Minister Ward. And it's been a pleasure to have you join us here at the Multicultural Media Online Forum. Thank you always for joining us every week, and we appreciate you sharing the messages to your community. If you have any questions, please send us an email, or please give us a chat and join us again next week. But for now, we'd like to let you know that the recording of this session is available on the New South Wales Multicultural Health Communication Service website. We appreciate your support, and please stay safe, get vaccinated, and be kind to one another. Take care.